Hi, how are you? My name is Rasman Georgi. I'm going to be your nurse for today. How are you feeling today? Good, good. How are you? So I'm going to provide privacy. I'm going to do hand hygiene. Can you please verify your name and date of birth for me? Yes, my name is Jane Smith. I was born July 22nd, 1968. Okay, can you please tell me where you are? Yes, I'm at the West Coast University Hospital. Can you tell me who is the president? Oh Lord. His name is Donald Trump. Perfect. Do you have any allergies? I don't have any allergies. Okay, I'm going to check his wrist to verify his name and date of birth. Perfect. So, Mrs. Smith, today I'm going to do a full assessment, head to toe, and that will require you to be cooperative with me, okay? So I don't want you to feel stressed. Everything is going to be okay. So first, I'm going to assess the scalp. I'm going to check the hair. I'm going to check for any abnormalities, any bruises, any surgeries. Scalp is okay. I'm going to go down and check the eyes. At this point, I will take my pen, turn it on, and check for perla, which is perla is accommodation of the eyes to the light, and to see if the eyes are equal and round. So I'm clicking. This is my pen. Left eye is okay. The pupils constrict the light. And Mrs. Smith, I want you to look at the tip of my finger. Okay, perfect. Can you follow my finger? Perfect. So I checked cranial nerves 3, 4, and 6. At this point, I'm going to check for drainage in both ears. The ears are okay. Mrs. Smith, which ear can you hear the sound? Oh, it's my left ear. And what about now? Where can you hear this? Which side? Oh, it's my right ear. Perfect. So I assessed cranial number 8. I'm going down to the nose. So I'm going to again turn my light on and look for any drainage in the nose to see if the nose is has any signs of congestion or blockage. The nose looks great. I'm going to ask the patient if he has any dentures. No, I don't have any dentures. My teeth are fine. So I'm going to assess the mouth. Please open your mouth. Say ah, ah. So the patient gets her tongue out. I'm going to look in the mouth. The mouth looks good inside. It's pink. It's moist. No ulcers. Teeth are great. At this point, I'm going to ask the patient to do the to swallow, to check for the gag reflex. Okay, he can swallow. So I assessed cranial nerves 9, 10, and 12. I'm going to check now for the lymph nodes, and I'm going to do that by using my tip of my toes. I'm going to get from the bottom of the ears, going slowly down towards the chin. I don't find any signs of lymph nodes. Okay. I'm going to, at this point, check the symmetry of the neck. The neck looks fine. It's symmetric. No deviations of the thyroid glands. I'm going to go down and check the shoulders, and I'm going to ask the patient to shrug the shoulders. Can you please shrug the shoulders for me? Okay, perfect. That's cranial nerve 11. I'm going to go down on my arms, on her arms. I'm going to check for any discolorations, bruises, IV lines. The patient looks, her arms are okay. I'm going to check bilaterally the radial pulse. Pulse looks great. Her heart rate is around 70 beats per minute. But of course, I'm going to count a full minute for a full in a real patient. So no bruises, no IV lines, no surgery scars. Hands look great. At this point, I'm going to use the stethoscope. Thank you for assisting me, Mrs. Smith, with my stethoscope. And I'm going to assess the heart. So I'm going to first start with the right second mid-clavicular line, which is the apical pulse. Then I'm going to go to the left second mid-clavicular line, which is the pulmonary vein. And now I'm going to go to the third left mid-clavicular line, which is the Erb's point. And now I'm going to go to the second left fourth intercostal space, which is the tricuspid. And the last one is the fifth intercostal space left side, which is the mitral or the apical pulse. Okay, so the heart sounds great. I'm going to auscultate the lungs at this point. Mrs. Smith, I want you to take a deep breath. One more. One more. Okay, one more. One more. And one more. I will, at this point, I'm going to turn the patient on the other side. And I'm going to auscultate the lungs in the back side. So I will do the 8 points, and I will take advantage at this time and check for any bruises, scars, surgery signs, marks. I'm going to check the coxal to see if the patient has any discolorations or ulcers at this point. The back looks great. Okay, Mrs. Smith, you can turn. Perfect. I'm going to go and assess the GI at this point. Mrs. Smith, when do you have a regular bowel? When was your last bowel movement? Oh, it was this morning. And did you go okay? Yeah, everything was great. So I'm going to first um, inspect. I'm going to look at the abdomen. I'm going to put my stethoscope, and I'm going to start from the right lower quadrant, going clockwise. If I hear bowel movements, that's great. If I don't hear any bowel movements, I'm going to have to listen for at least 5 minutes. So I'm going to start from the right lower quadrant, moving clockwise. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. And I can hear bowel sounds. I'm going to palpate to see if there's any rebound tenderness or pain. Do you have any pain, Mrs. Smith? No? Great. Okay, now I'm going to move into the GU. Mrs. Smith, when was your last menstrual period? Oh, it was 2 weeks ago. And did you notice any discoloration or any strong odor, any discharge? No, everything was okay. Also, at this point, I will assess to see if there's any discoloration, if there's any discharge, any abnormalities in the GI area. I will also assess the perianal area to see if the patient has any skin breakdown, because that will happen with the patients that have very strong diarrhea or very often diarrhea. I will ask the patient to do the range of motion for both arms. So Mrs. Smith, can you please move your arms? So this is abduction, when the patient moves the arms away from the body, and adduction is when the patient puts the hands towards the body. So the range of motion is good for the arms, and I will do the same thing for the legs. So can you please move your legs? Okay, I'm going to assist you on the left one as well. Your range of motion is good. I will assess the legs. I'm going to check the pulse behind the knees. Pedal pulse in both legs simultaneously, like I did with the arms when I checked the radial pulse. Okay, I'm going to check the capillary riffle. Perfect, it's less than 2 seconds. Can you please push your your feet against my arms? Perfect. Perfect. So the patient has very good range of motion and demonstrated that she has enough strength for a normal patient. At this point, I'm going to make sure that the patient is comfortable by asking her if she's comfortable, if she needs anything. I will make sure all appropriate belongings will be placed in her next to her side. I will make sure the call light is in place, her phone is in place, or glasses, and the remote control is next to her. And at this point, I'm going to lower the bed. I will discard my gloves into the appropriate compartment in the garbage. I will do hand hygiene, and I finish my assessments. If I forgot anything, one thing is that I should have asked the patient at the beginning to memorize 3 words, because at the end of my assessment, I would have asked the patient if she remembers the 3 words, and that would have been demonstrated to me that she's LOC times 4, not just times 3. So that's one of the things I forgot, but I did my best. So thank you, Mrs. Smith. I wish you a wonderful day, and I will see you very soon. If anything you need, just press the call light, okay? Thank you, Mr. Rasvan. You were great. I'll see you soon. Bye-bye.